You know that feeling, right? That stiffness when you first get out of bed, or that ache in your knees after a good walk. A lot of us just figure, hey, that's just part of getting older. But what if that nagging joint pain is actually a sign of something more than just simple wear and tear? Today, we are going to get into one of the most common health conditions out there, osteoarthritis. And we're going to kick things off by busting a huge myth. Is it really just about our bodies wearing out over time? Let's dive in and find out. You know, the phrase wear and tear makes it sound like our joints are like the tread on a car tire, just slowly and passively wearing away. But the reality of osteoarthritis, or OA, is so much more active, and honestly, way more interesting than that.
Now, I want you to focus on those two words, joint failure. That's a huge shift in thinking. Experts don't see OA as a passive wearing out process. They see it as a disease where the entire joint, we're talking the cartilage, the bone, the lining, the whole shebang, is actively failing and going through some major unhealthy changes.
Okay, so what does it actually mean for a joint to fail? It's not something that happens overnight. It's really a slow-motion breakdown of the delicate balance between damage and repair that's constantly happening inside the joint. So let's look at the key things that go wrong in this process. So first, that super smooth, protective cartilage on the ends of your bones starts to get frayed and thin. As a reaction, the bone right underneath it starts to remodel itself. It actually gets thicker and more dense. And then the body makes a kind of misguided attempt to stabilize the whole situation by growing these little bony projections called osteophytes, which you've probably heard of as bone spurs. And this process tends to pick on certain joints. The big weight-bearing ones like our knees and hips are prime targets. The spine is another common area, especially the neck and the lower back. And when it shows up in the hands, it's very specific, usually the joints closest to the fingertip, the middle knuckle, and the joint at the base of the thumb.
So the big question is, what puts someone at risk for this joint failure? Well, it's not just one single thing. It's usually a combination of factors that can tip the scales and get this process started.
And the number one risk factor, without a doubt, is age. The older we get, the higher the chances of these changes happening in our joints. For women in particular, the risk really starts to climb after about age 50. Next up is obesity. And this is where that old wear and tear idea really falls apart. It's not just about extra weight putting more physical stress on joints, although that's definitely part of it. We now know that fat tissue itself is biologically active, and it releases inflammatory signals that travel through the body and can contribute to joint damage. It's a double whammy. And finally, let's talk about old injuries. That torn ACL from your college soccer days, or a bad fracture from years ago? A major injury can permanently change how a joint works, setting the stage for what we call post-traumatic osteoarthritis, sometimes decades down the road. All right, we know who's at risk. But what does this whole process of joint failure actually feel like? How do all these changes happening deep inside the joint show up as symptoms that people experience every single day? Well, it all starts on a microscopic level. The cells inside your cartilage, which are called chondrocytes, basically go into overdrive. They start releasing enzymes that actually chew up the very cartilage they're supposed to be maintaining. As that protective cushion thins out, the bone underneath gets exposed to all sorts of new stresses, and it reacts by thickening up and growing those bone spurs. Now, this is a really cool diagnostic clue. A lot of people with OA say they feel stiff in the morning, but here is the key difference. With OA, that stiffness usually gets better in under 30 minutes. If it sticks around for longer, that might be a sign of a different kind of arthritis, like rheumatoid arthritis, which is more of an inflammatory disease. Some other classic signs? The pain typically gets worse when you're active and feels better when you rest. You might also notice what's called crepitus. That's a cracking, popping, or grinding feeling in the joint. And in the hands, doctors will look for those telltale bony bumps. They're called Heberden nodes when they're on the joint nearest the fingertip, and Bouchard nodes on the middle joint. And here's what a doctor actually sees on an X-ray. It's pretty clear when you compare them. In the joint with OA, the space between the bones is much narrower because the cartilage is gone. You can actually see the bone spurs, and the bone underneath looks whiter and thicker. And this is super important, how bad an X-ray looks doesn't always match how much pain a person feels. Okay, so we've got a handle on the problem. But here's the good news. There is so much you can do to manage it. The best way to think about it isn't a single cure, but a whole toolkit of different strategies you can use to feel better and stay active. The absolute cornerstone of managing OA is lifestyle. Things like weight loss, even a little bit, can take a massive load off your hips and knees. And strengthening the muscles around the joint, like your quads for your knee, is like building your own personal shock absorber. Of course, medical support can help too, from pain relievers and topical anti-inflammatory gels all the way up to total joint replacement surgery, which, for the right person, can be absolutely life-changing.
So, what's the big takeaway from all this? Well, while we don't have a way to reverse the changes of OA, we absolutely have a clear and effective path to manage the symptoms and live a full, active life.
So let's bring it all home. That old, outdated idea of wear and tear makes it sound like you should use your joints less to save them. But our modern understanding of OA as a dynamic disease of joint failure tells us to do the exact opposite. Appropriate, controlled movement is literally the best medicine. It helps nourish the cartilage you have left, and it strengthens the muscles that protect the joint. So the key isn't to accept limitations, it's about understanding your body so you can find smarter ways to keep moving for longer.